I'm Dr. Tyson Morostiga.
And I'm Dr. Derek Moore, and we are your sports quacks. All right, there, sports quacks. Today, what we're going to be talking about is something that you may have seen in the news lately, and that is basketball player for the 76ers, Markell Fultz, and his recent diagnosis of thoracic outlet syndrome. So in the podcast, we'll talk about thoracic outlet syndrome in general, kind of what we see when it comes into the office, how we diagnose, how we tend to treat or triage this type of diagnosis, and we'll get into a little bit of figuring out whether or not this diagnosis is a ruse or actual diagnosis for what Markell's going through. Because if you're unaware, Markell Fultz is supposed to be the star rookie for the Philadelphia 76ers, former number 1 round pick, and his shot has just gone from being one of the most reliable in college to shaky at best now. And thoracic outlet syndrome has been recently just put as his most recent diagnosis. And in case you guys don't understand what thoracic outlet syndrome, let me just go into it a little bit more before we begin. So thoracic outlet syndrome is a diagnosis of usually symptoms of numbness, pins and needles, sometimes even pain going down into the arm. And it's usually caused by some type of structural deficit, creating a blockage in either the brachial plexus or an artery that leads into a lack of blood flow down into the arm. So these structures can go anywhere from a rib issue where the first rib is a little bit longer, and that can sometimes create that closing effect where you just not get enough blood flow. A reported tightness within the scalenes, which is a lateral muscle out that attaches into the first rib, and then we've seen it go all the way down into the line where it's a pec issue, a tightness within the pec that can cause some of that blockage through there. But all of that can cause numbness, tingling, loss of proprioception within the hand and the arm, which can definitely start to play a role in not only Markell Fultz, but any basketball player who might have to use their arm in that shooting action. So, Tice, when it comes to thoracic outlet syndrome, how often are you seeing it? Are you, I guess, would be on board with the diagnosis? Just something not pass the smell test for you?
So obviously, we neither of us have seen him, and they don't release everything when it comes to these athletes. But you can use some of the keywords and terms and things that they've kind of how his injuries have progressed to kind of sniff out whether this is bullcrap or not. And initially, it kind of passes that smell test. It kind of does, because the progression kind of makes sense, right? So this injury started when in his rookie year, his rookie season, right? And he played a couple of games, played terribly, right? Like all of a sudden, like they saw an issue, right? And he said he came back and he goes, "Oh, it's an injury with my shoulder." So they called this a muscular imbalance of his scapula, which essentially means muscles in the front or the back are pulling more than the opposing muscles, and it causes the scapula to move in ways that it shouldn't, meaning his biomechanics are going to be thrown off and something's going to be an issue, right? Now, I find it really interesting that this was something that was missed or could possibly have been missed pre-draft or
Right.
when they're doing any type of scouting, right? Like, so with Markell, he was one of the best shooters in college basketball. Now, we're not saying like he had great field goal percentages, and it's not because he was a layup kind of get to the basket kind of guy. He was a jump shooter and a 3-point shooter. He's a threat. And so to see all of a sudden like this guy's shooting goes completely south is weird. And it wasn't just, here's the thing that was interesting is it was not just his percentages that dropped, his statistics. It was the motion, it was the form, it was ugly, it was
Uh-huh.
yippy, it was weird. So all of a sudden we have a guy who can't shoot without hitching. So think about Charles Barkley's golf swing, and that's the
Put that on the
equivalent.
foul line.
No joke. Put that on the foul line, right? And we're to the point where this dude got on the foul line a couple of weeks ago, and he's bouncing the ball back and forth
Yeah.
in his hands and just throws it up at the hoop. Now, why would a guy do that? Right? Why would a guy do that? My thought is that he has no proprioception. He has no awareness of where his body is in space, and he's lost all confidence in that. Now, here's where a lot of people want to be critics and want to jump and say, it must be mental, right? It must be the pressure, right? It's mental. And so a lot of these athletes get pegged as being soft or as being unable to overcome the mental challenges of being a professional and yada yada yada, and he's distracted by other things and this and that, whatever. What do I believe that this is mental? No, I don't, because at this point, going on for over a year and a half, like usually good players are able to snap out of these general yips. For me, my reference is putting, right? Players, with golfers, golfers yip with their putters, but they tend to figure stuff out over time. Usually because mechanically you can make mechanical corrections. Now, there's also someone in here that said that he worked with someone to alter his mechanics, and then that apparently it progressed worse from that point. So maybe somebody screwed him up while he was struggling with that injury, and things just didn't go well. Does that make sense?
Well, it makes perfect sense because what was his original diagnosis? Original diagnosis was a muscular imbalance. So I've done it. I'm not too sure if you've done it, Tice, but a lot of times when I see somebody who does have a little bit of stiffness or some problems with some ranges of motion, if they're trying to do a certain action, whether it's with their golf swing or whether it's with just a lifting technique, as we're working through that imbalance or that area of trying to regain some lost range of motion, it's not uncommon for them to say, like, hey, is it okay if I switch something up with the way that I lift, the way that I swing? I just feel like, you know what, if you have a trainer, if you have a golf pro, if you have a shooting coach, and he wants to do something with that, that's not a problem, because with the muscular imbalance, I really don't care what they do with the technique issue because they're trying to work around some range of motion. Mm-hmm. But if my diagnosis is TOS, or if my diagnosis is that you have lumbar disc herniation, it doesn't, and that player comes to me with the same question, hey, so I know you said that my pain's coming from my disc, but do you think I can switch something up about my golf swing to kind of save that? I'm just like, no. Like, what we have to do is stabilize.
Right.
No matter how much we can do to change the way that you swing your golf club, it's all a matter of we need to stabilize your lumbar spine and we need to address your hip mobility.
Sure.
I think it's going to be the same thing for him. It's going to be like, hey, listen, if it's a muscular imbalance, yeah, we can try to work around it because for now it's not going to cause you any long-term damage if you're just switching up your shot, because once we clear up the imbalance, you'll be good.
Yeah, but it screws him up financially.
Right.
Like,
but I mean, the good thing about Philadelphia is they've been used to just drafting guys and sitting them on the bench for a year.
So they're totally good because it's like, yeah, whatever. These guys don't play for a year anyways.
Right? Yeah, it's like that. They're fine with just benching every single person that they draft.
Trust the process, right?
I didn't think that, but if he was telling me, like, if it's TOS, and he's asking, like, hey, if I switch something about my shot, is this going to make a difference? And if there's a structural impediment to what's going on, it doesn't matter.
Well, let's talk about that. So so if you have someone who comes into your office and you're going, hey, you have a scapular imbalance, right?
Uh-huh.
How do you diagnose it? Is it static posture? Is it muscular dynamic movement testing? If it's a basketball player, how do you tell? Because I mean, when you think about it, most players I mean, I know where I want to go with this, but I want to pose it to you. If you have a basketball player who's shooting, right, and you're saying, okay, you have a scapular imbalance, how would you say that would affect their shot overhead, right? Like, what would you go to? How would you
Yeah.
test that?
Yeah, I mean, like you could just do that dynamic like lateral raise, abduction, and just watch to see how that scapular rises and falls.
Mm-hmm.
I mean, you could look at some static postures and see if they have a little bit of that anterior tilt, and then I would usually throw them into that impingement sign and see if they just have some issues to that. Like, are we talking about, hey, your shoulder just doesn't move very congruently with the with your humerus. That glenohumeral joint is creating a lot of issues there, and it's going to be a lot of just, I think, at the end of the day, a lot of just range of motion checking. Like, do we have a good amount of internal rotation? Can we get flexion without extension of the lumbar spine?
Sure.
You know, like I think when it's going to come to a muscular imbalance issue, all you're looking at is range of motion. And you're getting negatives on everything else.
Right. Well, let me ask you this: what if, and this is just throwing this out there, just because I am a skeptic, like all things, right? I just am. Like, it's just the way I'm built. What if some trainer looked at this first number one overall draft pick and said to him, man, you saw him shooting around and said, "Oh, your shoulder's really rolled forward. Do you have any pain?" And his response is, "No pain." And he goes, "Man, we should really change your posture and your positioning. Let's change your jump shot, the positioning of your shoulder," and then just completely screwed this kid up. Why?
Yeah,
if he had no pain, like if this kid's playing early in the season, he's plays 4 games, and he's cleared to play.
Uh-huh.
Like, why are we messing with him? Is it okay to leave an athlete the way they are and not change their mechanics?
Yeah, and I think you hit the nail on the head. It's just like, I think it's perfectly fine.
Yeah.
You know, my issue more so is just we try to reinvent the wheel when it comes to some of the treatment stuff, and maybe he did suffer an injury.
Yeah,
you know,
maybe.
And if he did suffer an injury in the shoulder, I don't think the immediate answer is, hey, let's change everything that you've been doing. You know, I feel like it was an easier way for them to, especially with the history of the Sixers, not really rushing guys back there. Just be like, hey, listen, there's some issues within the shoulder. It's going to take some time, but we're not going to do anything with the mechanics. We're just going to really just rehab the shoulder and see where it goes. But I'm more concerned with is how long of a process this has been, and now they're coming up with the diagnosis of TOS.
It seems a long ways out to now all of a sudden go, oh yeah, it's actually TOS.
Right.
The TOS is more serious than it sounds like it really is not something that you miss. A quality doc misses.
Well, I mean, so like, Tice, let me throw this out at you. How often do you see, let's just say, your new patient in the first 3 weeks? Just a general just a general guy,
6?
just who might have some around
visits,
6.
Twice a week usually.
So when I was working at the performance gym, if any one of the players had an injury, they were in medical every single day of the week.
Yeah.
They were in medical every single day of the week. So there is no way that Markell Fultz was not getting medical treatment every single day of the week, at least for the first 2 months of his original diagnosis.
Yeah.
And you're telling me, with the amount of time that you and I spend with the patient, so we'll say at max usually it's going to be about a half hour. So if he's getting PT, we're going to say probably an hour. He's going to get massage, probably an hour. You're telling me that nobody picked up on the fact that this kid was having numbness and tingling in his hand?
Huge red flag.
He never brought that up.
Yeah,
nobody ever was able to find that. Like, that's a symptom of TOS that you need for the diagnosis.
Yeah.
So it's either now you're just throwing out random diagnoses, just going to say like, hey, listen, let's just call it this to do that. Or you're going to tell me that everybody on your medical staff who's had an encounter with him didn't ask this kid, hey, do you have any numbness or tingling down your hand? Like,
Right.
what are you feeling? Like, is it just shoulder pain or is the pain anywhere else?
Yeah.
And I mean, I just don't see in a realistic world where these trainers' livelihood are dependent on whether or not this kid gets better.
Yeah.
That nobody asked that.
And keep in mind, these are supposed to be some of the smartest, brightest athletic trainers or whatever medical providers that you can buy, you can work with. Right?
Yeah,
like,
you can buy. Yeah, absolutely buy. Right.
That's it. I mean, it's there's something just doesn't kind of pass that smell test. There's just too many factors going on with this thing, to be honest. I mean, it's to me, I'm thinking about his therapies, his treatments, right? Like what's going on? How is this being actually? Let's go this. If you see someone and they're going, hey, I'm having issues with feeling the ball, sensing the ball. I'm having issues with it overhead. I'm having problems suddenly when I go to shoot. Then there, to me, that like jumps out, like, right, like, okay, that's my thoracic outlet, right? That doesn't get missed. That's something that draws out early in the draft. That's something that you see, right? So let's go to this, Derek. Let's run through causes of thoracic outlet syndrome. Now that we've like ripped them apart for the craziness of this whole debacle and misdiagnosis and probably the destroying of this kid's career, hopefully not. Let's go into more about what this kind of is, right? So big thing is thoracic outlet is the space between the collarbone and the first rib, right? So this space is where the brachial plexus and then blood supply to the arm goes out towards the shoulder. So we call it the neurovascular bundle, right? It's all, yep. You look at the brachial plexus on an image, right? And they like fan it out. So it's like this beautiful structure and you can see all the roots and all the branches and everything, when really it's just a wrapped up little bundle inside a sleeve. So the brachial plexus is sitting there. It runs out through the scalenes, under the clavicle, into the shoulder, right? So you're looking for where is this entrapment at, right? So how do you test it, right? So when somebody comes into my office and says, hey, I am having numbness, tingling, issues down into the hand, down into the arm, first thing is we have to think, is it neurological?
Yep.
Is it vascular, right? Vascular, I always love jumping to the fingernail test. How reliable is that? I don't know, but it gives me a good idea about blood flow. So I like doing neutral, and I like doing hand over the head, hand extended, right? Or extended back, right? Try and pull tension on that neurovascular bundle and test the fingernails to see if they refill with blood, right? You put pressure on them, they turn white, you take your finger off, they should go back. I've actually seen it a couple of times with older patients where it doesn't, but then with older patients, you got to worry about other complications.
Right, yeah, other things going on there. Yep.
Markell Fultz, you're not worrying about blood supply,
yeah,
vascular disorders like that. Secondly, what I want to do is I want to pull traction on the nerves, and I want to see if we can recreate some of the symptoms, right? So Derek, how would you do that? What's your process of like pulling traction on a nerve?
Yeah, so generally to kind of just traction the nerve, I really just kind of recreate how a lot of players, especially football players, will get a stinger. So I'll actually hold their wrist, apply some lateral traction, so I'm almost pulling them into abduction, mm-hmm. And then once I feel enough traction through there where their body starts to come with it, I just ask them to start to laterally flex their head away. So then as they start to do that, I'm telling them to go slow, and I'm just asking them what are they starting to feel. And I'll just have them hang out for 10, 15 seconds, just seeing if there's any changes. Because sometimes you might not get a good reading right away. And then all of a sudden it's just like, oh, yeah, I'm getting a little bit of tension in my neck, or I'm just feeling it in my hand. And sometimes I just say, I don't feel anything at all.
You make a great point there. Let's talk about that. Right? So when you test for thoracic outlet or you test for impingement, you let it take its time, right?
Yep.
It's not something that happens suddenly. It's not like,
Right.
oh, I traction you, you lean away, and it's like, oh, I'm numbness and tingling, unless there's some real. I mean, it can be.
It can be, right.
It can be, but it's rare, right?
Yes.
So when I think about Markell Fultz, and I'm looking at like, okay, this dude can dribble up and down the court, he can move, he can go for jump balls, he can dive on the ground, he can do all this stuff, and not have a problem. But all of a sudden, when he goes to shoot, he has some sort of neurological disorder or vascular disorder. That seems fishy to me. That all of a sudden his hands go up. Yes, it makes sense, but there's no way that suddenly changes the fact that he goes Charles Barkley on his jumper.
Right.
Doesn't make sense.
And a lot of times they'll talk. So he was, just for clarification too, he was diagnosed with neurogenic. So they ruled out. Yeah. So they ruled out vascular. They're saying it's completely neurogenic.
Interesting.
So now it's leading us to, and at least in my opinion, now it's leading us more into like the neck. Like scalenes, that brachial plexus coming out through there, and you start to wonder, just like, how did that happen? You see it with players. I forget, there was a prominent player. I think he played for the Mets, who had his first rib actually removed because he was having issues feeling the ball.
Yes.
But when you, I can't.
Carpenter had thoracic outlet, but I don't think he's the one who had that. I'll look it up while you're talking. Sorry.
Okay, yeah. So he was saying that he was having a hard time kind of feeling the ball. So they just go in there, and I'm pretty sure they definitely cut through the scalenes. I'm not 100% sure whether or not they removed his first rib, but that's not a very uncommon thing for orthopedic surgeons to do to correct thoracic outlet syndrome.
Matt Harvey.
Matt Harvey? Okay, yeah. Is removing the first rib and cutting the scalenes, which I'm just like, I don't understand who thought that's a great idea, but just like, hey, this is supposed to be here, let's just cut it out.
But this is the difference between professional athletes and general public, right?
Right,
this is
that's
his
true.
career, right? So if he's not getting any better and he's worth millions of dollars, obviously pitchers are like guaranteed money, massive contracts. Harvey was an all-star. He's a phenomenal pitcher.
Right. Yeah.
This dude's worth $100 million, and you're saying, dude, it's either this or you don't play again. You take my first rib out.
Right. But what I see there too is, think about that pitching motion, and even if you just picture the still shots of any pitcher in that windup, you can see a moment right as the ball is about to be released. They start to strain their neck away.
And
they start to lateral flex away, and then that arm is all the way laid back, and they're pulling through. And you're like, okay, I can see the traction injury or the repetitive stress that can cause a brachial plexus injury. Sure. You can easily look at that and see that.
Sure.
Where are you seeing that? Because like TOS is usually a repetitive injury, repetitive action injury. Where are you seeing that with what Markell Fultz is doing? Like a jump shot isn't straining the neck, and it's barely getting your arm over your shoulders. And then how many shots are you taking today? He's not Kobe Bryant. He's not jacking up 40 shots a game. He's not AI going out there, and he's also not playing this hard defense where he's getting a lot of traction injuries, like pulling his arm out trying to swipe at the ball.
Yeah. So that's a great point. So you have to have some sort of traction type injury to really affect this, because compression is not going to do this. Like, it's not like if I have my shoulder is rolled forward, and that's going to cause this. Like, you're going to put that much compression on it. It's not likely.
Right. And even if there was a compression injury, let's just say like he fell awkwardly, there would be tape. It would be easier for us to diagnose. But I mean, they were diagnosing him with a muscular imbalance. So it was just like, all right, it was a repetitive action, and they're thinking muscular imbalance, but a muscular imbalance doesn't often look like a nerve issue unless you're not asking the right questions.
Exactly. And there's no way, like I said, I keep saying this over and over again. There is no way that in the draft they draft him, or sorry, they asked him the wrong questions. There's no
Right.
way.
Yeah.
And there's no way this doesn't come up. Like you can look at a kid if you're assessing an athlete, and I guarantee, and any good athletic trainer will see, hey, this kid's got a really rolled forward shoulder, jacked up mechanics, like something's not right. We'll catch that right away. But people loved his mechanics. They loved his
Yeah.
fundamentals. That's why he was a high draft pick. Um, and who was he taken over? Wasn't he? He was taken over someone else that was big that year. Um,
I know they took him over
who did they take him over?
Jaylen Brown, the Celtics got.
Yeah. Let's
But as you look that up too, the one thing I also want to point out is when I was working with the combine, you have to remember that these players aren't getting evaluated by one medical team. Every single team gets a shot at them, and every single team runs them through orthopedic exams to a point where these kids feel beat up afterwards because they're doing every single orthopedic exam multiple times, and when they muscle test these guys, they're cranking on them. They're jumping down, like we're doing like a C5 muscle test, like you and me, we're just pushing down on the elbows, just looking for a rebound, making sure that they can hold that. No, like these guys are slamming down on the elbows, just seeing if they can hold that position. And all of that, all 30 plus teams in the NBA, I think it was pretty much a consensus. They're like, yeah, Fultz is the real deal. Like nobody's coming up with red flags saying like, oh, we're worried about his neck. We're worried about him not having him having this muscular imbalance. Nobody picked that up. Nobody was worried about that. So it's something that happened later on in the season, and then you're wondering, okay, is it Thoracic Outlet? Are they using this diagnosis as just a ploy to gain more time to kind of work through whatever he's working through? But I know you say you don't think it's the yips. I think it may have been an issue in the beginning, but now it's turning into a full-blown yips where they're just like, where he might be inside his own head.
Yeah. Well, that's the thing. Think about it. What buys you more time? A soft tissue injury or a nerve injury?
Like
right?
that, definitely a nerve injury, right?
Nerve injury, right? Like soft tissue injuries are weeks, are weeks, day to day type stuff. But you say, oh man, he's got a nerve issue, and then you buy the sympathy, and it buys him time, and it buys you time
Right.
to develop him again, and then talk about, correcting his shot and his form, and then all of a sudden you can play it off, and it buys you time. Like to me, that's makes sense to do it that way.
Right, but like you said too, just there, it was just like a muscular injury. Even though you and I know, like a lot of times if we're talking about like a really significant hamstring strain, a hamstring tear, that takes some time.
Sure.
But for the lay person, when they hear a muscular injury, they're just like, all right, you should be good in a few weeks. Like, where are you? Not go. We need you back out there, And if you're not back out there really quickly, people start thinking that you're dogging it and you're not fully devoted into getting better. But if you put out nerve, now everybody kind of backs away. It's like, hey, like he has a nerve injury, so this is going to take some time. People jump on that diagnosis a little bit more comfortably, and they're okay with taking time. Even though they don't know what TOS is, and they don't know what type of nerve injury that's happening. They just hear nerve, and they're just like, hey, this must be serious. It has to do with a nerve. And they're just going to jump along. And most people aren't going to question it.
It goes the other way, too. Like, how about Jalen Rose?
Right, yeah. Jalen Rose with a great line. It's just like, I never heard of it, so it must not exist kind of diagnosis. I'm like, you never heard, and that's a big thing, too. You never heard of it because I don't think it's a very, very common injury in basketball.
No, it's
I don't
not.
think it's something that you can put say like it's a repetitive stress injury. It's not like football where you get a stinger, and it's not like baseball where you have that repetitive strain with the throwing motion.
Yeah.
It's very hard to start to look at basketball mechanics and point to something that can recreate that type of stress that's needed to elicit TOS.
Yeah, that's exactly it. I mean, so let's go treatment wise. I mean, if I'm treating this, if I'm looking at him and from my standpoint, from what I know and what I kind of unfortunately have assumed in this case, I'm treating him. I'm treating him right. So I'm giving him if it is a true thoracic outlet, we're going combination of light treatment, rest. I'm doing stretching. What I'm doing, stretching scalenes, opening up the whole shoulder, working on mechanics, loading him into proper positioning. I mean, I'm sure they've done this stuff, but treatment-wise, what do you think about nerve traction type stuff? Beneficial,
You'd be
non-beneficial?
like, are you talking like nerve flossing?
Flossing type techniques, things
Yeah,
like that.
I'm cool with doing some nerve flossing,
Okay.
especially once we start asking him where he's starting to feel it. Are we starting to look at more median nerve? We start looking at more ulnar nerve.
Ooh,
So
we're getting
definitely start
fancy.
to
Like
yeah,
it.
right. Definitely just start to figure out where we're feeling some of that tension and kind of ride that line a little bit, and then even working down, like you said, working down into the arm. It's just like, all right, let's just if we're feeling more in the middle and index fingers, you're like, okay, let's just ride median nerve. Let's do pronated teres. Let's kind of work into coracoid brachialis. Like work the entire chain. Who the hell cares? You have all the time in the world. Work the entire chain, and then definitely hit the scalenes. And even ART has that great brachial plexus at the scalenes move.
Yeah, love it.
Where you're bringing the arm down and back and forth, and now it's like, flossing, you do the ART into the scalenes, that should clear things up relatively quickly, if it is true TOS. But if it's not, then we're just kind of, we're wasting time. And even then, are you adjusting them? I don't see any contraindication to adjust.
No, I think
right?
I think I'm adjusting. I don't know if I'm adjusting the first rib kind of move. Like I'm not going to go whack.
Yeah, right.
I'm not necessarily going to go whack on the first rib and say, oh yeah, let me just get the movement there and it's going to fix it. I don't really like that. I do like the idea of traction of the clavicle. Like a long axis traction. If I'm going to move something, I'd much rather move the clavicle on the rib than move the rib under the clavicle.
Yeah.
That's kind of my order of operations and the way that I like to approach things.
Right, and I think I'm definitely going after mid-cervical and CT junction, and definitely going after thoracic spine, just making sure that everything's working congruently when it comes to manipulation. And we'll looking at, just like you said, subclavius clavicle motion, making sure that everything's rotating properly. Like, we keep on beating this dead horse, but he has access to some of the best medical care, so nobody's rushing.
Right.
Work the entire line. You're clearing. Markell Fultz is coming into you with TOS. You're clearing your schedule. You're just like, all right, we're gonna figure this out. We'll block out 2 hours and we'll just figure it out.
Yeah.
But it's still so odd, and we talk about this every time, that some of these athletes have some of these odd diagnoses that just tend to linger and really put a big hole in these guys' careers, whether it's Tiger, whether it's Gronkowski, and now it's Markell Fultz, where you're sitting back and you're just wondering who's making these medical decisions and what's getting missed with these evaluations, that these high level athletes aren't getting the proper diagnosis and the proper following care. It's sometimes just crazy to me.
Well, it's always people want sexier, right? Like if you want, unfortunately, like you hear stories of athletes, of people going to the extreme because it's millions of dollars on the line, right? You want, if you have somebody worth a lot of money, unfortunately, sometimes people want the sexier move, and a simple nerve traction or nerve treatment down the arm is not sexy enough. One thing we're kind of coming to the end here, but I want to ask you one thing about this. Now we talk about we've touched a little bit about proprioception and the function, like nerve function, right? So anyone who's listening, we know that nerves do a couple of things. They receive sensory, and they also tell your body how to move, right? What muscles to fire, in what order, and what pattern to create the motion that we want. Derek, if you're talking about nerves losing, or basically your body losing the ability to move in a certain motion, or losing proprioception, where understanding where you are in space, I imagine, this is my thought, this is my understanding, is that needs to be some sort of long-term insult to a nerve, not just a sudden insult to the nerve, correct? Like, how do you feel about, oh, this started a week ago, we just found out he has thoracic outlet, and it's been pushing on the nerve for a week, and now all of a sudden he has no understanding of how to move his fingers or hands?
Yeah, I'm definitely with you with it being a long, slow burn where it's like chronic irritation, but it can be something that kind of popped up in a week. But I say that in only that you can also now pinpoint it. You know, if it popped up in a week, it had to be such a high amount of irritation that it's something that I think will stick out in the patient's history. Like, hey, what did you do in this past, it started a week ago. What happened in this past week? And if they're saying I didn't change anything in this past week, then I'm not thinking there's any way it could have happened in the past week, you know? But if he's just like, yeah, I just started out this high intensity plyometric upper body exercise program, and it's been just like kicking my ass. So I'm like, okay, that's something we might start to look into. Like a new variable thrown into their programming that's never been seen before. Body might just not be adapting well to it. But without that, I just don't see how it can't be anything else but a repetitive use injury.
Sure. I'm with you.
Yeah. So if as always, guys, we'd love to hear from you. You know, let us know about your experience with TOS and your patients who've had TOS. If you've seen it in the basketball community, and maybe it's more common than we think, maybe we're just blinded by where we see it in baseball and football, and maybe it is more predominant in basketball. We're just missing those diagnoses a little bit more often than we'd like to believe. And also let us know what you think about Markell Fultz. Maybe when you guys have some insider information, and we always like to kind of hear about what you guys know about whether or not you guys believe it's TOS, the muscular imbalance, or just a kid with the yips who just can't seem to get over it, you know. As always, follow us on Instagram, follow us on Facebook, like the podcast on iTunes and Podbean, and we'll talk to you guys at another time.